Late May, typically. I need more coffee, I guess, Mark. Okay, let's try this again. So we're going to do introductions real quick, and then we'll turn it over to our featured presenter today. So late May typically marks the start of summer vacation season. So I would like to know, what is one place you hope to visit in your lifetime? So as we go around the virtual roundtable here, your name, your agency, and what's a bucket list travel destination for you? So Evelyn, why don't you kick it off for us?
Well, I'm from Idaho Housing and Finance in the Coeur d'Alene office. I'm their family self-sufficiency specialist. And my bucket list is Scotland, because I've been to Ireland. I'd love to see the castles in Scotland.
Awesome. Wendy.
I'm Wendy, and I oversee Real Life Ministries Community Assistance. And on my bucket list is the mile-long zip line in Puerto Rico or Costa Rica.
Nice. Carrie.
Hi, everybody. Carrie Cedarquist, Community Impact Director for United Way of North Idaho. And I agree with Evelyn. I'd love to go to Scotland.
Scotland. 2 for Scotland. Michaela.
Hey, I'm Michaela. I'm from Mountain States Early Head Start, and I would like to go to Thailand.
Ooh, nice. Leslie.
Good morning. I'm Leslie Johnson from the Salvation Army Crop Center. I would like to go to Israel.
Awesome. Karen.
There we go. Hi, Karen from Department of Labor, workforce consultant. I work in the WIOA Youth Program. My bucket list is Italy, to tour the wine country.
Very nice. Vicki.
Hi, I'm Vicki Isaacs. I'm the Director of Workforce Training for North Idaho College. And Wendy, I have done that mile-long zip line in Costa Rica, and it's highly recommended. My bucket list destination, somewhere with the deep blue waters. A coworker just got back from Belize, and that looks amazing. So I wouldn't mind checking that out.
Awesome. Thank you. Lisa.
Hi, Lisa Donaldson with Family Promise of North Idaho, and I'm going to have to say Australia. I've always wanted to go there.
Fantastic. So far, all the answers are outside of the United States. That's not surprising, but Christine. Okay, we'll come back to Christine. Bev.
Hi, I'm Bev Moss with CD8, and I'm going to join Leslie in Israel.
Wow, another one for Israel. Cool. Chrissy. No, we had Chrissy, and then she jumped off before the question. Okay. Let's see here. Who else we have? Shelby.
Hi, I'm Shelby Walsh with the United Way of North Idaho. I would like to go to New Zealand.
Awesome, New Zealand. Great. Josh.
Hi, I'm Josh from Idaho Families. I'll stay a little more local. Alaska has always been on my bucket list, but lately I've been on a Tokyo kick, so I don't know.
Nice. Both good options. Jen Reynolds.
Good morning. I am with the United Way of North Idaho, and my bucket list location would be Australia.
Awesome. Cole Oaks. Okay, Cole. We'll come back to you. Let's go, Mr. Tucker.
Mark Tucker, United Way of North Idaho, and there's been a lot of items added to my bucket list for places to go, but the Colosseum in Rome still stays at the top.
Nice. Very, very nice. Cole, did you get your sound to work? No? Okay, no worries. We're happy you're here. Did I miss anybody? Yeah, you can put it in the chat too. Did I miss anybody? Awesome. Well, that's a win for me. I would say I'm going to have to go with those that selected Italy. That's some of my heritage, so I'd love to get back there and visit some of that area, or get back there like I've been there. Would love to be anywhere in Italy. Okay, so Don is from National Alliance on Mental Illness. May is Mental Health Awareness Month, and so we are delighted to have Don with us this morning. So Don, quick introduction about you would be great. Definitely we want to know your bucket list travel destination, and then dive into your presentation.
Okay. First of all, I'm not sure about sharing from my computer. I did give you the presentation. Can you do that, or?
If you prefer, I could. I just made you a host, so you should be able to, but if you would rather I do it, then go ahead and
That'd be great. It would
Okay.
save time for everyone.
Okay.
I'm a little green. I did it last night and it was okay, but today could be a different story.
Okay. Great.
So my name's Dawn, and I am a resident of Bonner County in Sandpoint. My about 30 years I've been here and have my children here, and I'm a veterinarian. I've had a practice here for 30 years, and how I got involved in NAMI, which is the National Alliance on Mental Illness, is that at 19, my son had a psychotic break. And being a doctor, I thought I knew everything, except I don't deal with the animals' brains. The way mental illness affects people is really different. So I didn't know how to navigate the health system, and it was a really long road. It's been about 10 years. And NAMI pretty much saved our family from a lot of grief, and we got on track because of them. So I'll give you a little quick info on NAMI. And do I tell you when to change the screen? Or can I do it? No?
Yeah, just tell me when to do it. And I need to stay on mute because they're starting to work on the road.
Okay, so you can move on. And I will tell you that my affiliate is NAMI Far North Idaho. There's 700 in the country. It's a national organization. And we are serving Bonner and Boundary County. Okay. Go ahead. So NAMI is the largest grassroots mental health org, and it's dedicated to building lives for millions of Americans affected by mental illness. And I believe you had someone here last month or the month before that talked to you as well from Coeur d'Alene. We work tirelessly, I will tell you, to raise awareness, provide education, advocacy, and support group programs for people in our community who live with mental illness and their loved ones. So it's both for, we call consumers. The ones living with mental illness are called consumers. And we also provide stuff for their family. Okay. There you go. One more. So our mission statement would be to promote the highest possible care for consumers, defending their rights. We want to elevate the level of sensitivity and knowledge base of healthcare professionals, law enforcement, and the general public. It's a big job because mental illness is kind of a slippery slope. NAMI actually provides all of this in a peer organized way. So people like me that have dealt with the system for 10 years will come on and really help people navigate. And I think that's our biggest thing that sets us apart from other mental illness places, is that we use a peer approach to help. Okay. And as you know, that these are staggering facts. It doesn't cross any barriers, economic or socio. Anybody can get sick, and that recovery is possible is a huge thing that we focus on. All right. So we know that they're not anyone's fault. I know that it's really easy to say it, but it's super true that these are medical illnesses that change how people think, feel, and act, and they are treatable and they're common. Okay. And here's another factoid sheet for me to share. This is a canned thing. I'm not sure how much you guys know, but it's pretty staggering that 1 in 5 experience a mental health condition. Also, about 20 to 30% of those have severe mental illness, and NAMI really focuses a lot on that. Okay. And stigma, we fight it every day. Everyone fights it. But especially with mental illness, we have a lot of stigma. And that can be a cultural thing. It can be like a professional thing where if you're a veteran, it's really hard to have PTSD because you're supposed to be brave. I think that it's really I'm ready for you, Mark. So these are our board members. They are about 8 of us that we have different backgrounds. As you know, I'm a veterinarian. We've got a lot of therapists on this board, 2 of them, and then 2 people that have severe mental illness that are in recovery and functioning quite well. We have someone from disability here, and I don't know. Anyway, it's a good group. So we all get along pretty well. We have a lot of fun, even though it's a serious issue that we deal with all the time. Okay. We're working on branding and marketing right now, and we are getting our word out there because I don't think a lot of people know what we have available. So we're really hitting it hard. But I want to talk to you about our clubhouse. That's our second one. So we'll move on. Keep going. So the Clubhouse project is something that I've been passionate about ever since my son got out of the state hospital. And as you know, that the difficulties are just so intense. Like there's stigma, there's barriers for healthcare barriers. There's all kinds of stuff that really work against people when they get out of the hospital. They really need a safe place to be and to get back into the workforce. So clubhouses have been very, very helpful. And they're just a great way for people to have purpose when they get out of these institutions or rehab centers. We got rid of some stuff in the 50s and 60s, and then it all kind of went to crap. Some of the logistical difficulties in our community are tough. We've got a lot of rent going on up here that is ridiculous. And we also have to have a downtown location for our clubhouse. But I wanted to tell you about the value of it. So go ahead and move on, because we're going to get over these obstacles, I think. We have found Clubhouse International, and this is the crux of what I want to talk about today. It's amazing. I'm so excited about it. 300 clubhouses in 30 countries. And these people have it together. They've got it super organized. And they have used 37 standards that are based out of, I don't know, they've got like 6 categories about how to do their clubhouse, basically. And those standards have helped them become very successful and provide really good outcomes for their members. They're not patients, they're actually members, and they operate their clubhouse together with a small staff through a concept called the work order day. And these are really amazing days where you're talking about, you can talk about little things like, what are you going to have for lunch and how will we make it, all the way to the transitional job force that they're trying to get out of this area and then move into the world. So there's a gradient of things that the staff work on. And the cool thing about Clubhouse International is that they will bring you your community. They will help you build from the bottom all the way up. There's training centers for new clubhouses, and it works. Okay, next slide. The reason it works is because they've done evidence-based research, and they've found that they just come out with so much success, higher rates of employment. And this is through this accredited clubhouse, not just any old clubhouse. They've found a significant decrease in hospitalizations, reduced incarcerations, better physical and mental health. And it's actually something that is very cost effective. So there are some sources down there. I really feel like that is really going to sell our community on getting donors and the government and the grants to come in for this. They're using Clubhouse transitional employment, and we would need all of you to maybe consider maybe getting involved in the future. Okay. I just wanted to, this is my dog Zephyr, actually my daughter's dog, but I inherited him. The thing is that with mental health, like I went to a dinner the other night, it was 100 people there supporting this woman whose son was killed by a policeman in Spokane. And he had schizophrenia. He didn't have a gun, and it was a horrible tragedy. And I sat there and was supporting this woman. And meanwhile, my son is calling me from somewhere in Boise, like needing a place to stay. He was on the street. And I thought to myself, it just felt really, really lonely. And I thought, you know, with NAMI and everything, like what we should be doing is really jumping in at the beginning of these mental illnesses and trying to really get ahead of it instead of coming up behind. And this clubhouse, tying into the clubhouse, would be like one of those things that would be really proactive, in my opinion. So I hope I didn't ramble too much, but I am passionate about what I do. So right now, I can't help my son anymore. He did go into recovery and got a college degree and a girlfriend, and everything was great, and then hit a bottom again. So it's kind of like a roller coaster. And right now I'm working on NAMI and getting other people help. Okay, well, that's it. Thank you for your time.
Thanks, Dawn, for the information and sharing your story. If you don't mind, we can open it up for a few questions. Questions for Dawn?
I have a question, Mark.
I do.
Uh-oh. Well, I can't see. Oh, there you are. Okay. Hi, Leslie.
Good morning. Thanks for sharing. I love your personal testimony and how you've gotten involved.
Thank you.
I wanted to know, could you tell us, I don't have a visual of what that clubhouse model looks like. Could you take us maybe through?
Yeah, so what happens is a member comes in and they meet the staff. That member will have certain needs that they may need. They may be very functional, but not ready yet to get a job. And so they'll need job training. Or maybe someone's just getting out and they really just need to learn how to cook again. I don't know what it is. There's a very wide range. And so they would come in, and it's voluntary. You don't have to sign anything. You can just come and go. But what happens is they get sucked in because they feel like they belong. So they'll come in and they'll do breakfast, lunch, dinner, whatever the facility is offering, they will be involved in. And then they will have different activities during the day, or maybe they will work on jobs. So basically they'll have people like the staff members will be there to help decide, like maybe get their plan. They'll have like life goals or short-term goals that they'll probably put on the table to figure out like where to start. But mostly they're just having this community that is safe and valuable for them. I imagine having voc rehab being involved, and then also a behavioral health facility also. We're working with, I'm going to be presenting to Bonner General Behavioral up here, or maybe Connexu. I'm not really sure which one yet. We're working with our board right now to decide if we want to do a training first, and then we will get more together. Is that more of a, there are videos online that have maybe, like there's a 10-minute video. I didn't think we had time right now, but the members actually talk about what they do there.
Okay.
That's been really helpful. So I can send that over if you're interested.
I'd love to see that. Is there a clubhouse in Kootenai County?
There was one, but it wasn't with Clubhouse International. I believe I talked to someone that ran it or owned it or was involved in it. It didn't work because it wasn't supervised, is what I remember. But maybe you all know more. There is one from Clubhouse International in Spokane that Catherine Peruz and I are going to visit soon. They're accredited.
Wonderful.
Hey,
thank you, Dawn.
Hey, Dawn, do you know if there is in the future thinking about opening one in Coeur Lane or Post Falls area? Because there is a need for that here, because there's no mental health really treatment here. You have to go to Spokane, or you have to go to all the way down to Orfino. So we're in desperate need to have that. And I personally have a family member who is dealing with hearing voices and dealing with all those schizophrenic type things. And she has the family, her kids have literally run into we don't know what to do. She's couch surfing. She has no place. She doesn't want to be alone. So it's hard for the family, and they all have to work because of our economy to support.
Well, think about the people that don't have families.
Yeah.
We were able to do the clubhouse for my son, but it was a job. It was so hard. Okay. So yeah, I talked to Donna Brundage and some people down there, and I don't believe there is anything. I'm so willing to work with all the counties. Like I would do Kootenai, Bonner, and Boundary. I think that would be awesome. But again, maybe you want it to be downtown, closer to other resources, like we were thinking here. I just don't know. So,
Dawn, I think your involvement is excellent. NAMI has not had really a good, solid reputation in our community. I think with Donna being on the board and she's really starting to steer it in the right direction. Very encouraging.
Tell me what you mean by that.
I think awareness and education, being involved in different groups and really explaining the heart behind it. I'm hearing more of that.
If y'all are interested, there's a family and friends presentation that I do. It's 90 minutes, and I usually do it on a Friday at lunch. That thing is amazing because it tells you all about the different mental illnesses. It gives you empathy exercises. It advocates for all kinds of stuff. So if you're interested, just send me your info and I'll let you know when the next one is. Because we really, people like that, the education. And then our support groups are really good, I think. They saved me. Like I was not okay.
Hey, Dawn, I'm going to put my email address so that we can in the chat.
Okay.
Because I really like to get more information, because I think that is a desperate need, especially in Kootenai County, because we don't have the resources that we should have it, because we have a lot of mental health people that are struggling.
People like you, we can have grants, we can have all these donors. There's so much money up here. I think we can do this. The budget is about 200,000. I can't remember. It depends on your size, how it runs, but I'm sure it's going to be pretty expensive to run. But what if we were to run it out of the craft center? Or I don't know, we couldn't do that. I don't know. I'm not there yet. I just wanted to present the idea and go to the training.
Other questions for Dawn?
I had a question, which you kind of did answer a little bit, which is related to opportunities to provide funding to NAMI. Do you guys do grant writing for your program?
Catherine Peruz does. We have a pretty good bank account right now. We're waiting though. We want to use it for a really good project. We had a crisis line here. It was a good project, but it ended up not being used. And it was very expensive to run. It was $7,000 or $8,000 a month. So now we are waiting. I think we're going to group up with a behavioral health facility and try to do this Clubhouse is what my gut feeling is, because I'm in charge. I'm the president. I can do whatever I want, right? I'm just kidding. Okay.
Well, and something else that occurred to me. So we do have a grant opportunity. So I'll follow up with you on that through our community care fund. But then the other thing I was curious about is you mentioned the cost of facilities and knowing kind of from other community partners and past jobs that sometimes people experiencing a mental health crisis or whether it's just how it presents can struggle through things that other people might find easy. So like housing applications, for example, or applying for benefits or things like that. So is there a network of like education and advocacy that could help support these, like the service providers that are in Kootenai County, Bonner County to kind of help ease that? Or is that an opportunity for this group to maybe do some training and understand, you know, if we get a referral from NAMI, what ways could we be of best help and support to folks that might be struggling through their basic needs or, you know, higher needs?
Yeah, we have an Envision Center up here that's doing a lot of that for people. So I think that's good. But the Clubhouse would be something where you would want to be involved directly with. That way we're just all working together right away. We don't have to outsource you. I don't know, that would be my thought. But right now there isn't anything other than the Envision Center that we have up here. Community Resource Envision Center. Has anyone heard of it?
Yeah, definitely.
Yes.
Okay, I'm sure.
So in other words, what I'm hearing is the Clubhouse is sort of that hub of information, advocacy, and resources.
Totally all puts it together. It's it would be amazing because filling out those forms, wow. Like for disability, for SSI, all of that stuff, that was so hard. I had to do all that. It was ugly. And I wasn't even the sick one, right?
Right. Dawn,
okay.
Dawn, we really appreciate your time sharing the information. I think everyone would agree that, you know, this is an area that we need additional support and resources. So kudos to you for your work in what you've done. I know you have to jump off, but I know that we'll get your contact information out to this group, and I'm sure there'll be some additional follow-up conversations that'll lead to some other opportunities for us to assist and help. But again, thank you, Dawn, for your time.
Thank you, especially for the slideshow. That was my worry.
No problem. All right, so let's switch gears. And for anyone that is a first timer here, welcome. Typically, our agenda is we have a featured presenter, which we just did on NAMI from Dawn, and then we do a virtual roundtable. And this is your opportunity to share maybe resources that you either have or recently discovered, updates on your agency or things that you want to promote, events or new tools and resources or news, as well as we love to hear challenges that you're facing, because a lot of times we're able to bring light some resources that would help with your challenges. And of course, we also love to hear wins. What went well? What win did your agency or have you heard? Because those are important as well. This is heavy stuff, so you have to remember to share the wins as well. So who would like to kick off our virtual roundtable?
I can start if that's all right.
Thanks, Carrie.
Okay, I have a few things for everybody. So first of all, this just kind of launching off of that presentation about NAMI, wanted to remind or introduce to the group that we do have funding for regional grants that are specifically designed to support programs that provide behavioral health supports for youth up to age 13. So in addition to our regular grant process, which happens every year, this is a more flexible source of funds that we can mobilize more quickly. Some of the organizations that have been funded pretty rapidly in this last couple of months have been iCare, Children's Village. There's the Selkirk Outdoor Leadership that provided some Head Start slots for summer camps. And certainly if you have programs or services that fall within this area of behavioral supports out of school time, and some mitigating or reducing summer learning loss for youth up to age 13. It's a really simple process. You'll simply email a letter of interest to me describing the program, including a budget of the program. And then if you're an agency that hasn't been funded through us before, then we'll need a little bit more financial documentation, but I'll follow up on that with you individually. So as soon as I'm finished, I'll put my email in the chat. The second thing is we have been in talks with a remote refugee resettlement program based out of DC for Ukrainian refugees. What they do is they place Ukrainian refugees who have family connections is this remote resettlement program. And essentially they came to us to learn if we could help facilitate this for a family that has, a Ukrainian family that has family members in Coeur d'Alene. And so the network of community partners would be supporting this family finding housing, transportation, employment, etc. So I've talked with a few of you already, and we have a planning meeting set up with the coordinator out of DC for, I believe, next week. So Real Life Ministries, Family Promise, St. Vincent de Paul, I believe those, I think Croc Center might be, Leslie, I might need to follow up with you on that. But if you have an interest or an ability to help support this, the informational session, I'll send that to Chris because I can't remember what it is exactly right now, but it'll be just an hour-long meeting to learn more about the program. And I think with a network, this could be a low lift for everybody, but could help a family in crisis and also, promote that our community is a welcoming community to these folks. So that's number 2. And then number 3 is our awards luncheon is coming up in June. And every year we recognize a nonprofit professional of the year, as well as a volunteer of the year. If you have someone in mind that you'd like to nominate, please do so. Mark might have a link ready to go, but we'll also follow up with that. One of the great things is that we're able to make a small donation in that award winner's name to the organization they're affiliated with. And we typically see 150, 170 people attend that luncheon. So it's a great opportunity to recognize the organization and those hardworking professionals and volunteers.
Thanks, Carrie.
Thank you.
Who would like to go next?
Carrie, I just had a quick question. Sorry, I don't mean to.
You're fine.
In here. So just because you mentioned in regards to the Ukrainian family that you're helping, I also have a Ukrainian family that I know really well that I've been trying to work with. And they are actually bringing over 24 of their family members. They're completely moving their family of 8 out of their home and moving into a trailer so that their family can move into their home. And they're obviously having a lot of overhead costs, mostly for the flights, trying to get them over here and whatnot. And then in addition to that, on her side, she has another 8 family members coming later on. And then even 2 months from now, there's another additional 7 on his side, her husband's side, that are coming from Ukraine as well. So as you can imagine, there is going to be a huge need for her. And I'm trying to put together, or she's trying to put together a list of needs that they might have, because it's such a huge thing to take on. As you can imagine, just their family of 8 is enough in that house that they're in. Now they're taking on like almost 30 more people, which is mind-boggling to think about. But I don't know if there's any additional resources that you'd be able to send my way. Wendy, I don't know if you have anything else that I could get them connected to. I'm just waiting to hear back from her as far as like a list of things that they might need.
Yeah, Cole, can I add you to that planning meeting? This is really new to me. I understand that there are some resources associated with it through the Office of Refugee Resettlement. But again, this is super new to me. So I think just trying to combine our efforts is probably gonna produce the best outcomes. So would you drop your email in the chat and I'll make sure you get on that list?
Yeah, I will do that. Thanks, Carrie.
Okay, who's up next?
I'll go.
Thanks, Lisa.
Exciting stuff at Family Promise. Since last month, we did graduate a family of 6 into housing, and we did that with the help of St. Vincent de Paul and their rapid rehousing program. And also, we went to our congregations and asked them if we can go back to serving 3 families at a time again, and we got the go on that. So I'm in the process of looking for a 3rd family right now and have interviews coming up tomorrow. So like I'm feeling a little bit more sense of normalcy again, and glad to be able to help as many people as we can. And then I did get a little more funding for my Hand of Promise homeless prevention. So I'm going to be putting that back up, the application back up online again today, so that anybody that needs help can go to familypromiseni.org and apply as long as they have a 3-day pay or quit notice.
Thanks, Lisa.
I'll go, Mark.
All right.
Or Chris, I'm sorry.
You're fine. Either one works.
I was looking up at my upper right or upper left-hand screen. Leslie Johnson from the Kroc Center. We now have 2 families in our Pathway of Hope program, which is working together, getting the families out of intergenerational poverty, working with them for 6 months up to 1 year. So one family is a single mom with 5 children, all different fathers and no child support. And the other mom is a single mom with 1 son. And both of those women, one woman still in a shelter, one woman just moved into an apartment. So partnering with St. Vincent de Paul on the housing piece and just coming alongside those families, it's been really great. I did want to just put out to this group, there's an event happening on Saturday. It's called Capes and Crowns. And I'm going to put in the chat the Eventbrite sign up. It's on a referral basis only, but if you happen to know a woman who is really struggling, that is needing some encouragement, we're going to have a nutritionist speaking. We'll have a focus on goal setting. The whole day is free of charge. It's put on by Pamela, Faye, and Friends, which is a nonprofit. A friend of mine that I used to work with puts together. So it's just a group of us women, and we're going to be doing some art, and it's completely free for any woman who you refer that you really feel is in need of being just loved on for the day. So the event starts at 8:30 and it'll go all the way till 5. Breakfast is served, lunch is served, and we'll have a follow-up art event. So we have room for a few more ladies.
Thanks, Leslie. That's fantastic.
You're welcome.
Vicki.
Hi, some of you have seen or heard me announce this, and I'm still waiting for a press release, hopefully to come out soon, but just wanted to share that the Workforce Training Center has been successful in getting a $524,000 grant to start new programs in the construction industry. So if you know folks that might be interested in going into that field, we have gotten those programs approved on the Idaho launch list. And so they will be eligible for that, which means that hopefully the majority of those costs will be covered for that training. We also built in some scholarship funds to that grant. So the difference of what launch does not cover could be covered by those scholarships. So we're currently in development of those programs and looking for instructors, and we hope to kick those programs off, late summer, early fall, but just wanted to let you guys all know that that was in the works. Other than that, I don't have anything new. We're busier than ever, and you folks have all done a good job of referring your customers, clients to us. And we have lots of launch vouchers coming our way. So most folks are getting their training programs for very low cost. So it's super exciting. Oh, someone just posted a link. Leslie. Oh, thanks. I thought it was in relation to the, I thought maybe the press release came out and I didn't see it, but still watching for that. Thank you.
Awesome. Thanks, Vicki.
Next. I'm Wendy with Real Life Ministries Community Assistance. For those who are new, we have a soup kitchen, a food room, and we do assistance with rent/mortgage and utilities. I had some awesome volunteers who did a table at the Stand Down for Veterans event last Saturday, and it went really well. They were really impressed with how well it was put on and organized. So just if your organization hasn't done it and you have resources for veterans, that's a great event to jump on to next year if you're able to. So, and I was going to suggest, since mental health seems to be ever increasing issue in the community, we're seeing more and more people coming in that are obviously struggling in that area. We might want to invite Mike Wraith to come and speak with us. He oversees the mobile response unit in Kootenai County.
What was his last name?
Wraith, W-R-A-I-T-H.
Excellent. I have noted that, and I will see what I can uncover, see if we can't get him in to speak. Fantastic. Thanks, Wendy. David.
Yeah, real quick. I'm on the board for NAMI in North Idaho, and these are some events. I'm just going to post them in the chat here that are coming up. Coming on the 14th is a kite flying. It's just a visual way of raising awareness, and then the 9th of July in City Park is NAMI is participating in the Housing Resource Festival, and then this Disability Action Center ADA Fair in July, and then the walk in September. So those are just some things that are coming up. We have group sessions and court peer connection Zoom groups, and if anyone is in need of those resources, send them our way. So that's for the sake of NAMI. That's it.
Thanks, David. Appreciate it. Other shares, wins, struggles, challenges, updates?
Not much happening here. I'm just trying to get people. I work for the Family Self-Sufficiency program in the HUD program, getting families, resources for jobs, mental health, all those things that you guys are supplying. I'm giving to my participants while they're working and trying to increase their income and get off of hopefully some of the assistance that they need and get them more self-sufficient. I have a lot of openings, so I'm trying to right now call anybody who has did a yes survey and hopefully get more people in this program, because if you graduate from the FSS program successfully, besides getting escrow fund, which is simply put, if you earn more and your rent gets increased, they match that rent increase and put it aside in escrow fund. And when you graduate, you get that lump sum. Then you get to the HOPES program, which is a homeowners, counseling, and also they down payment assistance. And with this housing market going crazy, they're actually upping how much they're matching. So if, let's say, a client of mine has 5,000 put down, they'll match it with 10 and put 10,000, so they have now 15. But it's hard to get people to get enrolled in this program, even though it's an amazing program. All you have to do is work, or at least try to work. So if you know anybody who's on HUD, encourage them to join the FSS program, because I have openings and it's hard to get people to come into this program.
And Evelyn, it's called the FSS program?
Yeah, Family Self-Sufficiency Program. And it's run by Idaho Housing and Finance with their HUD program, or Section 8.
Excellent, thank you. Other shares, updates?
Hi, this is Chrissy from Navigation.
Hi, Chrissy.
And
thank you.
I just received an email from our program manager that the National Maternal Health Hotline is now live. So for mothers who may be struggling with postpartum, you don't need a diagnosis. I posted the number there, so that's something we can share with everybody. With Navigation, we still have career enhancement funding, emergency rental assistance funding, as well as some kinship funding for those families raising children that are relatives or non-relatives or kinship type relationships. So we're still taking referrals. All of our referrals go through the 211 line. And we actually have a new navigator who will be starting on May 23rd. So I will likely be taking her out and about to meet people in person, so she can put names to faces, and we're excited to have her. I think she's going to do a great job.
Excellent, thanks, Chrissy. So Kaylin from Community Action Partners, she wasn't able to make it, but she wanted me to throw a question out to the group. So her question is there a list of counselors that work with people on Medicaid? Any direction or resources that anybody knows for her question?
I know Keith Orchard with the school district has had some good threads going in an email about that. If you want to send that to me, I can send it out.
Okay, will do.
That reminds me, Chris, just for this group, we do have a counselor now in our building at the Kroc Center. It's cash only, but they do have room. It's called Radiant Christian Counseling. It's a female counselor. There's two females, one that specializes with children.
Excellent.
And if there's an incredibly pressing situation where counseling is really needed, but a neighbor can't afford it, you can certainly refer them to me, and I will vet them to determine if it would be something that we could pay for a few sessions. We also are developing a team of life coaches and pastors. So, you know, if a person isn't really, it's not a critical situation where they're needing counseling, but it's more of a life coaching or kind of a pastoral type need, then we can refer them in that direction.
So Leslie, the Radiant Christian Counseling, is that on your information on your website, or do they just call in for information?
I think it's on our website. We did just send out an email to all of our members, just indicating that they are now in our building, that they have capacity for clients, and that they're cash pay only. They are working on getting Blue Cross approved, but that's not yet. And we haven't put out that it's from a social services standpoint, that would be something that we could look at. We're just trying to really kind of keep that under wraps because that money will go very quickly.
Right. Got it.
Leslie, if you could you email that information to me as well?
Wendy, you were kind of cutting out. Will you say that again?
Could Leslie email me the information for Radiant Christian Counseling. We do have a counseling resource booklet that we've put together, and so we'd like to be able to get that added in there.
Oh, you bet. I'd happy to do that, Wendy. Thank you.
Wendy, are you able to share that resource booklet with us?
Let me find out. We actually have a gal on staff who has been put in charge specifically to work on mental health issues and stuff. And she's the one who's put it together. So let me find out if it's in a format where I can email it out to you guys. And yeah, and she is also working on developing a team of mental health coaches and stuff too as well. So recognizing we don't have enough professionals in the areas and trying to come up with support systems to help fill that gap for people who aren't in a critical need, but can do more of a lay counselor type support.
Thanks, Wendy. All right, anybody else?
I can share that training if you wanted. So many of you know that this group started when we created it, or had created the ALICE report locally way back in 2016, seems like forever ago. And that data has been used quite a bit from agencies. Hopefully you're all using it. But one of the big reasons that it was created by Rutgers University and United Ways in the Northeast was as a way to talk to legislators about the people in our communities that were struggling, especially those that were working. So as you hopefully know, ALICE is an acronym for Asset Limited Income Constrained Employed. So there is a webinar coming up on June 8th that is done for those that have the ALICE report. It's primarily targeted towards United Ways, but I think everybody on this call understands the importance of the data. But this webinar is on how to use it for advocacy and outreach. And it's primarily targeted around public policy. So if that's something that's of interest to you, I think we could use this this information to benefit our entire community and likely the entire state if we all work together. So, Carrie just put the link to the registration in the chat. So if anybody's interested, it is a free webinar. I believe it is 11 a.m. on June 2nd. And I'll also put the ALICE report website in the chat if you haven't had a chance to look at it. It did a children focus update about a month or so ago. That's all I have.
Thanks, Mark. All righty, well, thank you, everybody. Hopefully you all gleaned some valuable information. Maybe you made some connections, and at a minimum, I know all your wheels are turning on how you can support each other and use some of these resources to assist some of those in your circle. So again, I thank you all for your time, efforts, and energy, and I will see you all next month. Thank you very much.
Thank you all.
Bye.
See you all. Thanks, Kurt. Thanks, everybody.
Yes.